Hi, this is Dr. Bob Dannenhoffer doing another of our Facebook Live events. Last time there was a question about lip reading, and so this is a special mask that Kristen had made for people who do lip reading, and hopefully you can read a little bit through here. It's a little bit hard for some people to see under the glare, so I'm going to take it down and then just continue. So again, Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. Welcome you again tonight. It's May 8th, and we'll do our briefing. So it's a tremendous amount to discuss today. We filled a whole page here, and we may even have more. And most importantly, we're going to take your questions. So if you're on Facebook Live, please put them in the chat section. We'll try and get to as many of the questions as we can tonight. If we can't get to them all, I'll work on them tonight and over the weekend and answer your questions individually. So as we always do, looking at COVID-19 throughout the world, it is a grim situation. We did pass 4 million cases in the world today and almost 250,000 deaths. So this is still very, very, very active in the world with cases really in almost every part of the world. Europe is starting to stabilize a little bit, but they still have a lot of cases, and there are big outbreaks in Russia, Brazil, Qatar, and Peru. So the big outbreaks we're seeing now are many of them in very warm areas of the world, suggesting that we're not going to have a huge decrease as the weather gets warmer. In the U.S., we're still at about 1.3 million cases and 77,000 deaths. Just a huge outbreak in New York. Although they're past the peak of it, they're still having hundreds of cases a day and hundreds of deaths. We're starting to see big outbreaks in more rural areas. So we're starting to see them in the Midwest in meatpacking plants. We're seeing them on several Navy ships, many correctional institutions. Oregon's been pretty stable. We've been between 20 and 100 cases a day now for a month, without any big real increase or decrease. And Douglas County is doing even better than that. We're still at 24 cases. We've been at 24 cases now for a month. And of those 24, 22 have recovered, so that only 2 are considered to be active cases at this time. A very slow rate. We still, thank goodness, have not had any deaths and only have 1 hospitalization. So I think we're doing pretty well. We talked earlier in the week about Shutter Creek. We're still very worried about that because they're now well over 20 cases there, and that's just south of our border, so we may start to see some cases there. Otherwise, we're doing well, and we'll take your questions. So we have some here. So Andrea says, any new cases here? And the answer is no new cases this whole week, which is a good thing. Now, we are screening a lot of people. We had 31 today in our drive-through clinic. Again, we're testing anyone who has a doctor's order to be tested, symptomatic, asymptomatic, whatever. They did a great job. They're very fast today. They do a lovely job with those swabs. So although it's uncomfortable, they've gotten so good at it that they're doing well. We've not had a rejected test in a while. So Amy asks, will gyms reopen under the new guidelines? And the answer is I think they will. So under the new guidelines for the state, they came up with what they call sector guidelines. So for example, the restaurant, bars, and winery sector guidance is done, and they suggest they can open. And they have some rules. For example, bars aren't allowed to have bar service, but allowed to have table service. They're supposed to have distancing of the tables. There's a recommendation that you have 1 server rather than go through multiple people who go to your table. There's a request that people wear masks when appropriate to use and not to have dishes that need to be cleaned. I think this is going to work. I think restaurants are going to start to get back. I think there are going to be 2 issues. One is, can restaurants open? The second issue is, will people go to restaurants? And I think with those things, it's safe. So yes, I'm going to go. So will stores and restaurants open on May 15th? So here's the process here. So the governor has a plan for phased reopening of Oregon. That plan for phased reopening says that areas that are ready, and there are a bunch of criteria for being ready, can apply to the governor and say, we'd like to open up in the first phase, and if they're found to be ready, then they can open up on May the 15th. Douglas County submitted that application yesterday, and I have some news that it's complete, so we'll see what the governor says about that. And if that's the case, we'll know by next week. and then restaurants and stores can open up on May 15th. Now, there are very few stores now that are closed by the governor's order. Only toy stores, gift shops, and furniture stores are the only 3 that are closed on the governor's order. All of the stores can open, but again, we're wanting people to be social distancing. So when people ask about, well, from a public health standpoint, what should we open and what should we leave closed and what should we do? The answer is I always look at it on the basis of risk. And I do that all the time. Let's take even before COVID came around. People would say, well, what about smoking? And I don't ever say you shouldn't smoke. What I say is smoking is a really high risk activity. 1/3 of the people who smoke will have something bad happen in their life due to smoking. So my recommendation would be to stop. Now, sometimes people listen to that recommendation and stop smoking, and sometimes people continue to smoke. Similarly, with COVID-19, public health makes recommendations, and my recommendation is to be safe. And the best way to be safe is stay home when you're sick, social distance at 6 feet, wear a mask if you can ensure social distancing, wash your hands a lot, and stay healthy. So on May 15th, will they open? I don't know, but I think there's a good chance that stores and restaurants will open in Southern Oregon, at least by May 15th. I don't know about the Willamette Valley. They're still struggling a little bit, so they may not open by then. I think Eastern Oregon also has a good chance to be open by then. So Thaddeus asks, if 25% of Douglas County residents became infected, would our hospital be able to handle it? Absolutely not. And so, absolutely not. So if 25% of the population became infected, about 20% of those would need to be hospitalized. So I know there's over 100,000. Well, let's just take 100,000. So we have 25,000 people in the county that got infected over the space of a month. And the time that they get infected is important, but let's say over a month. And 20% of those, or 5,000, need to be admitted. That would totally overwhelm the hospital system. And that's what our whole plan was initially, was to prevent that huge sharp rise so that people would get overwhelmed. So instead of 25% of the population, we had 25 in 100,000 get infected. So we did just that. So yeah, there'd be no way that any place in the world could withstand 25% of the people being infected. New York, an area with tremendous resources, had a few 100,000 cases in a population of 20 million. So they never even got to 1% of the population. Yeah, can you talk, so someone asked, can you talk about the serious illness in children and what we should be looking for? So this is a weird thing. So in the areas where there's a lot of COVID disease, they've noticed this unusual illness among kids. And this unusual illness in kids is a big inflammatory disease. Take that off for now. Is an incredible inflammatory disease that looks like something called Kawasaki disease. So Kawasaki disease, we've known about for many, many years. It's a disease that was first noted in Japan and occasionally is noted in the United States. So I went to a conference earlier this year where we spent an hour talking about Kawasaki disease, and there are a couple of 100 cases a year in the U.S. And, it's a bad disease. You get a lot of fever. The kids are incredibly cranky. They have red eyes, a tongue that really looks like a strawberry. So it's called a strawberry tongue. They get a rash, and their body has incredible amounts of inflammation, and especially inflammation of the arteries in the heart, so you can wind up with little aneurysms in the heart. So it's a very important disease, but it's really rare. So in all the years I've done pediatrics, I've only seen 3 cases. So it's not a very common disease, but what they've noted was in areas where there's a lot of COVID disease, in Italy and England and in New York, they've also seen a lot of these cases where the kids have a disease that looks like Kawasaki's disease. It's not exactly the same, but it looks like it. And they have a lot of cases. So in New York, I saw today over 20 cases and 1 death, sadly, in New York of this disease, where in New York, you'd only expect 1 or 2 at a time. One person said my ICU has 6 at once. There's something weird going on here. And the thing that's unusual is that not all of these kids have tested positive for COVID. Some have a positive molecular test. Some have a positive antibody test, but some don't have a positive test at all. So why you should see this weird disease in kids, which is not really at all like the disease in adults, at the same time, and the kids not all test positive, This is a great mystery, so I'm going to spend a lot of time this weekend reading about it. The question is, should we be concerned? I don't think so. It seems only to be prevalent in areas where there's a high amount of COVID disease, and here there's a very low amount. So I think if any place in the world you can be comfortable, it's here. But I think as pediatricians overall, we really need to be concerned about what this is and see if we can figure it any better. So the question is, will pediatric offices open in phase 1, Holly asks. Turns out that pediatric offices were never closed, but a lot of the pediatricians in town were just cautious because they didn't want to spread the disease. I think now that the incidence of diseases in Douglas County at least is lower, and we're knowing a little bit more, I think you'll see some of the pediatric offices start to open up a little bit. So for example, at Aviva, where I practice a few days a week, we're going to start doing well baby checks in the office for kids who are otherwise well, who are less than 2 years. We'll also see kids in office if they have something that should be seen like a rash. But again, many of the things you can do by telehealth, and I did a bunch of telehealth visits this week, and they work well. So the pediatric office that I work in is open. We've not seen very many kids in the office, but I think over the next few weeks that will change. So Andrea asks, what do you think about Casey's restaurant opening? So the answer is, I believe that's all political. That's not a public health, so I don't want to comment about that. But what I will comment about restaurants is that restaurants are part of American society, and as part of American society, we want people to be safe. So in the new guidelines for reopening, it gives ideas about what restaurants may do. And again, what it suggests is that if you do it, that you don't have bar seating, that they say, because there's no way to protect the waitress because they're just a few inches away, really, sometimes. They recommend spacing. They recommend only one wait staff per table. So I think they've come up with some really good guidelines, and I think we'll do that. Casey's, they can do what they want. So when residents get an antibody test and it's positive, will DPHN be given the results? Do they get added to the positive case count, Sandra asks. A great question. I was on a conference this week, and I think we talked about this for an hour with all the little nuances about what happens if you have a positive molecular test and a positive antibody test, or a positive molecular test and a negative antibody test, or all the other ways. So what Oregon has decided that a positive antibody test on its own, we're going to note, we do get the results, but we're going to call that a positive antibody test rather than a positive case. The reason we're a little cautious about adding those as cases is because some of the antibody tests, not all of them, but some of the antibody tests have a really high false positive rate. So one of them had a 20% false positive rate. That it means that 20% of the time they gave a positive test when the person could not have had the disease because they were testing blood from the time before the disease existed. So we don't know what to do with the positive antibody tests, so we're certainly looking at them. We have 4 positives in the county now, 4 positive antibody tests in the county, none of which are any surprise. And but they don't get increased to the case count. Now, if we have people have a positive antibody test, we'll also encourage them to get a positive, to do a nasal swab, because some of those will be positive. You remember our last case was exactly somebody had a positive antibody test. We did a nasal swab, which was positive, but by the time we got the nasal swab back, they were totally asymptomatic. So will the White MCA open on the 15th? And the answer is, I don't know. I guess that's it. I don't know. So what's the out-of-pocket cost for the swab test, Jedediah asks. So the story is, for the drive-through clinics that we do, we have an arrangement with Quest Laboratories that we will do it. And since it's a test ordered by a doctor, the president has promised that nobody will pay for a test that's ordered by their doctor. So Quest says we will charge insurance companies, we'll charge Medicare and Medicaid. For people uninsured, we're not going to charge anybody, but the feds had said they'll pay for those tests, and we're not going to send any bill to any patient. So far, we think that's 100% correct. So if anybody's been through our drive-in and seen any bill, let me know, because that would go against what Quest said. So no charge, and we don't charge anything for collecting the swab. So again, that was one of the questions I worked with the state, is what are you doing for low-income residents? I don't think you can get cheaper than free. Yeah, so Ashley asks, what do you think about the guidelines for youth sports? Could they practice? And the answer is, I haven't gone through the outdoor recreation ones fully yet, so I don't know the answers. Again, so the story with kids and sports is we think outdoor activities are an order of magnitude safer than indoor activities. We think kids going out and play is a good thing. We do worry about some sports where there's a lot of close contact. I mean, think a huddle in football. And then other sports like cross-country running with probably lower risk. So I think in the next week or so, as those guidelines get more solidified, we'll know a little bit better. So Jedediah asks, since we've started testing asymptomatic people, will we soon be able to get tested without a doctor's order? The answer is, Jedediah asks, I mean, the problem with this is that we can't guarantee you won't get a bill. And for us to separate out who's going to get a bill and who's not going to get a bill is just way more complicated than we want it to be. In addition, if you have a positive test, somebody needs to follow up on that positive test. And since somebody needs to follow up on that test, we really want your doctor to do it. Again, we've talked to the docs in town, and for the most part, they said, sure, we'll go ahead and do that. And so if you can't get one, send a private note, and I'll answer that privately. So my sister has lots of aches and a rash and was tested yesterday. What's the word on rashes? Andrew asks. Well, we're learning a lot on this. Rash does not seem to be a prominent part of this disease. However, there is an urticarial rash, which is a hive-like rash, a petechial rash, and then a frostbite-like rash that have all been associated with COVID. So, there are a lot of different rashes, so I don't know. Perfectly great to get tested. Again, we're not, there's the classic presentation where you have fever, cough, dyspnea, and diarrhea. But when they looked at the people who worked in the nursing homes in Washington, what they found was that there was no classic presentation. That of the people who were positive, some had only one of those symptoms. Some had sort of vague symptoms. Some had no symptoms at all. So I think if you want to get tested, you should get tested. So Lynn asked, could it be a mutation of COVID in regard to kids? And certainly it could be, although if it was just a mutation, you wouldn't expect it to think it would just affect kids. And you would think that the antibody test is not so discriminatory that it wouldn't pick this up. But I don't know what it is. But it's interesting because we never know what causes Kawasaki's disease. So Kawasaki's disease has been around for a while, and it's weird because they have done such extensive work to see what causes it, and they've never found anything. So I don't know what causes it, but this is going to be another mystery that I like to follow. So Veronica asks, are you telling people who get tested to isolate until totally well since they could have a false negative? Veronica, you're exactly right. So if you are sick and get the test, then you should stay home until you're asymptomatic so that you won't do it. Now, we don't think that the disease is spreadable. Now, you may have RNA in your nose, but we don't think it's spreadable 10 days after the symptoms have started. And that's the good news. People say, well, then how can you still find the RNA in the nose? And they say it's like bugs on your windshield. They're clearly no longer alive, but if you look for DNA, bug DNA, the bug DNA is on your windshield until you get a car wash. So does Douglas County have reopening guidelines, or do businesses follow the governor's orders? So in Douglas County, we follow the governor's orders to close. We're going to follow the governor's orders to open. Douglas County has not made up any new guidelines for sectors. We're going to follow the state guidelines. So Christine asked, will essential workers get tested? And the answer is, Oregon hasn't specifically defined who the essential workers are. We're going to test anybody who wants to get tested. Now, the problem with the molecular test, which is this test in your nose, is that it's only positive when it's positive and can be negative one day and then positive the next. So you may have heard today that one of the president's staff had been tested earlier in the week and it was negative, but then tested positive this week. And so that's the problem with these tests, is these tests only tell you that you're negative at this snapshot, but don't say you'll be positive or negative later on. I think the best strategy for essential workers is to look for people who have symptoms immediately when they have symptoms to test them, and then if they're positive, test all the people around them. That's the strategy that's worked best in Korea. That's the strategy that worked best in Singapore. the strategy of testing lots of asymptomatic people is important to know what the background levels are, but in terms of knocking down the disease, that has not been successful anywhere. But again, if you want to get tested, talk to your doc, and we can get that done. So Andrea asks, have you heard anything about dogs getting COVID? And yes, dogs and tigers can both get it. So with most of these viruses that pass between animals and people, and we think this one passes between animals and people, we think this probably started with bats. Pangolins, which are these spiny anteaters, which are absolutely adorable. You should just look at them on Facebook. They are just absolutely adorable looking. I mean, think of like one of those little hedgehogs with scales instead of hair, and they're really adorable. But we think they get it and people get it. But in many cases, the other animals that get this, and we think cats and dogs can get this, they don't really spread it among other cats and dogs, and they get sick, but apparently it's not really a bad sickness. It's more like the cold that most coronaviruses also cause. So you don't want to make your dog and cat sick, so the recommendation is to stay away from your cat and dog, probably not snuggle with them when you're sick. All of those things are reasonable. But we don't think dogs are going to be a source of significant spread. So Lynn says, have any of the positive cases complained of smelling or tasting mold? The one that's been noticed most is that people have a loss of sense of smell, and really a profound loss of sense of smell. But you remember we did the little thing where we did a drive-through, and the people who didn't smell were all negative, and the people who tested positive all could smell fine. So you've heard less about that. The other thing that has been noted is that people have unusual smells. So anosmia means no smell, but dysosmia, which means you have bad smell. There's some reports of that now, and it's not specifically mold, it's just things don't smell right. And that's not surprising. I mean, the way your smell works is you have these smell receptors, and we think that COVID attacks epithelial cells and probably makes them send either no signal, can't smell at all, or the wrong signal, this smells bad. Oh boy. So Ryan asks, yeah. So he's talking about case fatality rate and infection fatality rate. So a case fatality rate or infection fatality rate, these things depend upon how many cases you find. And so when I give my briefing to the docs all the time, when I talk about what the death percentage is, and that's the number of deaths and the number of cases, and if you were we think if you were finding all the cases, that the fatality rate would be about 1 or 2%. So for example, if you look at the Diamond Princess, where I think they did find all the cases, it was about 2%. On the Teddy Roosevelt, which is the biggest aircraft carrier, it was less than 1%. It was about 0.5%. I think it's going to wind up in the end as the fatality rate there. When you see throughout the world that it's 7%, it means that we're missing many mild and mildly symptomatic cases. 7% is really high. In the end, in Korea, it wound up at about 2%. In China, it wound up about 3%. In Wuhan, so I think it's going to wind up somewhere there. When you look in Oregon, we're a little over 100 cases and a little over 2,000, almost 3,000 cases, and a little over 100 deaths. We're a little over about 3%. So it sounds in Oregon we're still not finding all the cases, and I think that's probably true. Now, they've said in other places, if you found every case, maybe the fatality rate would be as low as 0.2%. That's based on sort of a flawed data. So that's based on antibody studies that looked at the rate, for example, of people in Santa Clara County and what their rate was. And it suggested that the background rate of disease was about 4%, and the case fatality rate was low. But again, that depends upon the antibody test being correct. So I don't think we're going to know. I think in the U.S., very few places have been less than 1%. So I think in the end, this is going to wind up between about 1 and 3%. So CF Thing says, aren't all viruses infections and can kill anyone without underlying issues? We can't live in fear anymore. So
I don't live in fear. I know a lot about this disease. I don't live in fear. I take very simple precautions. As you know, I use face coverings. I have social distancing. I don't do anything serious or dangerous. Go to work every day. And so that's it. But this is a disease that I do worry about for other people. I certainly worry about it for my mom. She's 90 years old. And I do worry that if she starts going to church every day, as she's done for 90 years, that she could get infected. And I do worry about that. And so what I recommend is that she watch church on TV, which she does now. And so what I recommend that people do is that they do safe things. I think the reopening guidelines that I've seen so far all look totally reasonable, and we can do things with an acceptable risk. Now, setting what that risk level is very interesting. So one of the things that I'm following really, really closely is, the 3 Scandinavian countries, and we have Finland, Sweden, and Norway, that are similar countries, high socioeconomic standards, all in about the same geographic area. And Norway and Finland have taken one approach, which is the approach that most of the EU has taken, which is to kind of shut down most activities and try and keep infection rates and death rates low. Sweden, on the other hand, has been much more liberal with their social policies, and people are still in restaurants and parks and bars and whatever else. And we're seeing how this plays out. Well, in the short run, the death rate in Sweden is 8 times more than the death rate in Finland and Norway. What may happen over time is that Finland and Norway get there, but get to that same death rate, but they just get there slower. And in the end, we'll see how this works out, but no one knows how it works out. So the answer is we can't live in fear anymore. Your question is we can't live in fear anymore. The answer is you shouldn't be fearful. You should be apprised of what goes on, and you should do a risk analysis, and you should take that risk. But you have to recognize that for us who are relatively young and healthy, yes, our risk may be low, but we do have parents. We do have older people that we take care of. Our kids work in nursing homes. So if I'm reckless and get the disease and pass it to my kids, and then they work in a nursing home and give it to one of the old people, that will be terrible. So I don't want anybody to live in fear, but I do want people to recognize that this is a dangerous virus. This is much more dangerous than the annual flu. Many times more contagious and many times more deadly. So really it is something to pay attention to. So in phase 1, what are the recommendations with kids if you're having a gathering or outing for social distancing? Well, again, the idea would be to have as few contacts as possible, but we recognize that kids are going to have some gatherings. There is going to be a recommendation for summer schools and summer camps. I have not seen it yet, but it's coming. So Crystal says, I run our billiards league. Well, that is great. Will bars and pool tables be open in phase 1, 2, or 3? I did see the recommendation say, and I think in phase 1 at least, that they're asking that pool tables and ping pong tables be closed in phase 1. I think that was what it is. But you can find these. These are on the OHA website in the sector guidelines. And again, as the governor explained it in the press conference yesterday, I guess she grew up in Minnesota, and she said, in the wintertime, the ice is there and it looks inviting, and what you do is you walk on it, you look to see if it starts cracking, and then you walk a little bit further, and a little bit further, and a little bit further, and that's basically how her analogy on how we're going to approach this. And I think that's a good approach, because I think if we go too fast and fall in and then have to go back is going to be really demoralizing. So my sense is that people have done a great job with this stay at home, stay healthy. They've really done an incredibly good job at following the rules, and we've seen the great results. I think if we go too fast and see a big uptick in disease, and then we have to go back to this, it's going to be really demoralizing. So I think the idea of going slow, giving it a few weeks to see what happens, if that works okay, to do a little bit more, and then to do a little bit more still. So Annabelle asks, scary charts have been posted, I haven't seen them, that show flu deaths as much worse than COVID. Is this true? Well, so we've talked about this before. So the story is that flu is a bad disease. And public health spends a lot of time trying to convince people to get flu vaccines. We do these drive-through flu vaccination clinics because we really do care about flu, because flu is a bad disease. If you've ever had it, it's pretty miserable. The death rate, though, for flu is pretty low. And when you look at the death rate for flu, they say, well, 50 or 30 or 80,000 people a year die of the flu. And that's because of the way we do death certificates. So the way we do death certificates, somebody dies, and let's say I was in family practice, the funeral director comes to me and says, Bob, Mrs. Smith died. What did she die of? So, I don't know, I haven't seen her recently, but she had COPD and she had flu a few weeks ago. Okay, so her death is going to be COPD with secondary illness of the flu. That's great. And so her death then gets recorded as one of the flu deaths. Now with flu, people don't really die in the hospital very much. So, I worked for years at Mercy in the department that looked at census and whatever else. And during even the worst of the flu years, we would have half a dozen or so people with flu, 1 or 2 people in the ICU, and we'd have the occasional death. But most of the deaths from the flu are deaths at home later on after the flu. There'll be old people who just dwindle. This is really different with COVID. These people with COVID, many of them are dying in the ICU. These are people who are otherwise, who get really sick, who are dying in this heroic place in the ICU because they get sick, and they get sick so quickly. So yes, flu is worrisome, but COVID is so much more worrisome. Remember, when we look at flu, flu doubles every 3 weeks during the worst of the season. This would double in every 3 days. Flu never overwhelms the hospital system. At the very worst, hospitals are stressed during a bad flu season, but never overwhelms the hospital like COVID would. So yes, flu is important. It's really important. COVID is much worse. Yeah, so Linda says, with false positives, could that be the reason we don't have a high positive? False negatives do occur, and they occur especially on the COVID test, not because the test is bad, but it's really hard to know if you get the right amount of boogers with this, right? You're sticking this thing 5 inches in, you can't see obviously where it's going, and you don't know how much gets on the swab. Now, we do it exactly right. You put it in, you let it sit for 4 seconds, you twirl for 4 seconds, you leave it for another 4 seconds, and then you twirl, and then you pull it out. So we do it exactly the way you're supposed to do it. But it's a blind procedure, so you don't know. So yes, some of the false negatives will be there, but we don't think we have any more false negatives than anybody else. We think that everybody who does nasopharyngeal tests has false negatives. Now, there's a new saliva test, that was one of the things on here, and that they're now going to be doing. Wow, wouldn't that be great if you could get good positive results from spit, because spit is so much easier than these nasal swabs. So we'll see about that. But yeah, I don't think here is any different than anywhere else. If anything, the people who do the nasopharyngeal swabs here do a lot of them, and so they get really good at them. Other places, a doc may be 2 or 3 in a season. Here, the people are doing 31 in a day, so they get really good. I've done over 100 now, and so that I don't think the reason our low rates here are false negatives. So why is the wait between phases 21 days as opposed to 14 or 28? Well, the incubation period on this disease is between 2 and 14 days. And usually in public health, we would suggest 2 incubation periods, which would be 28 days. We don't know where people came up with the 14 days, because for no other disease would we do it at 1 incubation period. And I believe the 21 was a compromise. So when can I see my grandkids again? I really want to see my grandkids too. Well, it's a risk, right? And so when we talked about before about living in fear and the risk, so the risk is too, right? The risk is that you're going to see your grandkids and you're going to get it from your grandkids. But I think their fear is that they're going to give it to you. So I think this is a risk. I think once the disease starts to be very quiescent, that is, we're down, our positive rate is less than 1%, I think then the risk of doing those things is low. The problem, unfortunately, unless grandparents live right here, like my mom lives back east, there's still a lot of disease in Virginia. And I'm not sure that it would be safe for me to go to Virginia, circulate in Virginia, maybe get the disease and see her. So I don't know. It's going to be one of those risk tolerance things. I think for right now, the risk is lowish. Again, the recommendations still are, if you're in a high-risk group, to stay home. If you're a grandparent and not a high-risk group, the recommendation is still to limit gatherings to 10. So I'd have you look at those guidelines and follow them as best you can. So Red asks, is DPHN still testing? Yep, we tested today, I think 31 today. And are we getting the lab results? It's very quick. In fact, we have all the lab results back except for today. So they're getting back very quickly, day 2 or 3 at the highest. So they're getting back very quickly. So Brian says, can you talk about the underlying health conditions and risk? Yeah, so they've looked at this, now that they have many cases in New York, and there seem to be risk factors. I think people of color are really at much higher risk than others. Immigrants seem to be much higher risk. People in lower socioeconomic groups seem to be much higher risk. People with vascular disease, especially coronary artery disease, seem to be really high risk. People with lung disease, COPD, seem to be at high risk. People with obesity seem to be at high risk. People with hypertension seem to be at high risk. People with cancer and autoimmune diseases are a little bit higher risk. Asthma, which was initially thought to be a risk, probably not a great risk. Neurodegenerative diseases like Alzheimer's, a risk. However, it's hard to know if that's just an age-related thing. So how many people have recovered? So of the 24 cases in the county, 22 have recovered. Now, when we talk about recovered, we're talking about no longer in the infectious phase. However, many of these people continue to have some significant symptoms. Shortness of breath, some are still using oxygen, some just feel ridiculously tired. I mean, like sleeping 20 hours a day tired. Some of the people have reported continuing really bad diarrhea, and some of the people have ongoing headaches. So even though they may be recovered from a virologic sense, symptom-wise, they're still struggling. So Christine asked, can you explain why COVID is dangerous for diabetics? And again, we think COVID is dangerous for diabetics, and I'm not sure I included in that list before, because this disease seems to really affect the vasculature. So you may have heard about blood clots and vascular problems in different places, and diabetics have lots of troubles with their blood vessels, and that's why diabetics without COVID wind up with troubles with gangrene in the toes. They wind up with troubles with claudication. They wind up with more heart attacks. So we think it's more dangerous for diabetics because diabetics, we think, have underlying vascular disease. So Lori asked, do you think it should be mandatory to wear masks at grocery stores? So again, I go to the grocery store a couple of times a week, and I always wear my mask. I mean, just absolute routinely. And I do this not because I don't want to get sick, but so that if I'm in that pre-symptomatic phase the day or two before I develop symptoms, I don't want to make the other people sick. I mean, these people who are working at grocery stores, they have a hard job. They're around a lot of people. They're not making a lot of money, and they're putting themselves at risk every day. So if I can wear my mask and decrease the risk I put about, I would do that anytime. So, on all this stuff on mandatory, I mean, I don't think we're going to have the mask police, but I think we do want to be respectful of others. So I'm tremendously respectful of those people who get up every day, go to work, take some risk. If all I have to do is wear a mask, that's easy. So, so Kelly asks, if phase 3 is supposed to be in September and we keep isolating, won't things spike more due to lack of herd exposure? So again, herd immunity means that if enough people are allergic or have had a disease and have antibodies against the disease, that disease then can't spread in the population. And that's why we're so into getting everybody measles vaccine, because if everybody was immunized against the measles, then measles could never spread in a population. And what we've seen over the last few years is that certain areas that had low immunization rates, like the Orthodox Jewish population in New York that had very low immunization rates, measles really spread and caused lots of trouble. So yeah, we really believe in herd immunity. There are two troubles with this. One is to get herd immunity for this disease, you'd have to be up in the 50s or 60s. And to get enough people with the illness to get in the 50s and 60s is going to be a lot of deaths, right? So to get 60% herd immunity in Douglas County would mean about 60,000 people would have the disease. Of that 60,000, 12,000 would be in the hospital, which would overwhelm the hospital system, would be a lot of people. And we think about, let's say 2 or 3%, as we talked before. So 2,000 people would die. I don't think that's a logical calculus. I mean, I'm not willing to put up with 2,000 deaths so that we can get back to other things. The other problem with this is we're not sure that immunity is long-lasting. So there is some good data that people who have this, pretty much everybody develops antibodies, but we don't know how long those antibodies are going to last. We talked last time about the coronavirus, other coronaviruses, the one that cause common colds, where people do develop antibodies. Those antibodies don't seem to be long-lasting. They certainly don't seem to last forever, and they may not even last more than a year or so. So the concern is that you'd go through all this death to build up the herd immunity, and then it would come back anyway. So I think we have to learn a little bit more about how the antibodies work. I think building up herd immunity is really not a worthwhile process. Now, we do have the natural experiment in Sweden, and we'll see if they build up significant herd immunity and whether that strategy is better. I would bet not, but it's the future. So are we using antibodies to fight COVID? And the answer is yes. We think this convalescent serum, which is the serum that you draw from people who've had the disease and then give it to people with the disease, does seem to help a little bit. It has not been as magical as we thought it would be. So we thought that convalescent serum would really work. It does not seem to be magic, at least for COVID. So if you think of like diphtheria, where antitoxin works great, so Call of the Wild and the Iditarod race, where the dogs are racing this serum to the outpost and whatever, and saved all these lives. Unfortunately, convalescent serum seems to have helped, but it doesn't seem nearly that magic. And do antibodies keep us from getting it again? As I said before, we don't know. With some of the other coronaviruses, the data is mixed. We think it does probably protect you in the short run, but whether that's a longer lasting immunity, we don't know. So it said Mercy is doing the saliva test. Is that true? I don't think so. It just got approved today, so I don't think so yet. But I don't know. We can check. I'll put this on one of my things to check. So Zach says, we don't have any deaths here yet, right? And so the answer is we do not have any deaths in Douglas County. Now, we do have a critically ill person, so we're certainly praying for him, but we don't have any deaths yet. But that's not surprising. Again, remember the death rate is usually a few percent. So with 24 cases, it wouldn't be surprising that we wouldn't have any deaths. So my question is, Dana asks, where did I get this mask? I got this mask from Kristen. And do we have more? We do have more. So if there's people who want it, so if you have somebody in the house who's hard of hearing or somebody around who you'd like to do that, you can get it for it. So Shirley says, how long does it take to get results from the antibody test? Not very long, a day or two. And again, the story on the antibody test, and this is one thing I'm going to talk about here. Again, remember the antibody test, there are two kinds. One is the bedside test that looks like the little pregnancy test. Those have really come under fire. And actually, the FDA this week told the manufacturers, look, you have to have a higher degree of sensitivity or specificity or you must stop selling. Because I think people are very worried that people are going to get positive tests, think they're immune, and then take less social distancing precautions and get it again. So we worry about that. The ones that you get from the big labs like Quest and LabCorp and Mayo have very low false positive rates, still 1 or 2%, but much better than the other ones. We're getting those results back in a few days. And as I said, we have 4 positives, none of which are a great surprise. So, Karina asks, are they testing before every elective procedure? So, elective procedures are those kind of things where you go in maybe to have a colonoscopy or have your tonsils out or something. There are no requirements for elective testing, but I hear Mercy is doing testing within the 96 hours before elective procedures. And I think that's smart for a couple of reasons. One is they don't want to have people have the disease in the hospital and not have great precautions. Now, they take great precautions, but if they have it, maybe their family members who are visiting will have it. So I think it's good to do that. The second that we know is that there are some cases in New York where people had elective procedures and had COVID at the time, and they did much worse than people who did not have COVID or did not have elective procedures. So I think it's good to screen for people before elective procedures. And again, this is screening asymptomatic people, and we've talked about that. Well, if you have a specific thing to screen for, like before surgery, that makes sense. But to sort of screen everybody asymptomatically is problematic because you have to do a lot of tests, and the tests are really quite uncomfortable. And you'd have to test a couple of times a week, and as we can see from the White House, even doing that doesn't help very much. So a lot of officials keep referencing that we won't be back to normal until we get a vaccine. Are they confident we will get one in 12 months, Ryan asks. Yeah, I don't think a vaccine is the only way we're going to get through this. So a vaccine could work. Vaccines are hard to develop. There are, I understand, multiple vaccines under development. Moderna is now into phase 2, which is going to be a good thing, which is going to be a larger trial to look for the development of antibodies and whatever. But vaccines are very complicated. So the last time I talked about this thing called mice lie and monkeys exaggerate, which means that when you test out vaccines in mice, they're frequently wrong. And when you test them in monkeys, it looks much better than it does in people. And so there's this thing by Paul Offit, this podcast, which is very technical but amazing about all of the troubles in making vaccines. Are we confident that we'll get one in 12 months? So Paul says, well, the quickest one we ever got was 5 years. And that was with mumps, which was a very easy one to do. This one is much more complicated. And so to suggest we'll get it in 12 months is a great goal. So one of the incredible things in my childhood was the space race. So President Kennedy in early 60s says we're going to get a man to the moon and safely back to Earth by the end of this decade. People say, well, that's crazy. We haven't put anything into space yet. The idea, how can we ever get to the moon and back and whatever? So in the 60s, my dad was an engineer and he was part of the lunar project. And so all in the 60s, we were incredible space nerds and thinking about this. And the idea that in the early 60s, when Kennedy said this, that by the end of the decade we would do this, seemed absolutely impossible. Yet, with a lot of hard work and a lot of American ingenuity, we got it done. I think similarly with vaccines, I would love to see this as the space race of 2020. And the space race of 2020 is everybody's got to work together. Everybody needs to do the best they can and get this going. So in that time, my dad worked untold hours of overtime to go ahead and get this done. There was tremendous enthusiasm. For the most part, people all worked together. There were so many companies that made this. There was no one company in the world that was big enough to put the space race together. So all of these were made by different companies, and they all worked together to get this going. So I think the space race for me now is to get a going vaccine in 12 months. And that's going to take a lot. There was a story today. It's not just making the vaccine. Now you have to make the vaccine. Now you have to purify it. Now you have to purify these huge amounts. Then you have to have the glass vials to put it in and the needles and whatever do it. Then you need to have an army of people to go ahead and deliver this vaccine. So you remember we've been doing these flu drive-thrus. We are just planning to get 10,000 doses of vaccine one night and the next day say we're going to have 6 drive-thrus in Douglas County at all the various fire stations and give everybody the vaccine. Now, can we get it done in 12 months? I don't know. Nobody would have predicted that we'd be to the moon and back in 69. Yet we did it. And so the goal is, I'm hoping that we do the same with this vaccine. So Lisa asks, can you get COVID again after you've already had it? This is tremendously up in the air. There have certainly been cases of people who have had COVID, had negative tests, positive antibodies, and then later have positive antibodies again. And it's unknown whether this is the disease again, whether this was just a test that didn't catch enough virus in the middle. There are not a lot of cases where people had it, got over it, and then got really sick again. So nobody knows the answer to this, but this is clearly going to be an important question, right? Because if we start to see people on their second or third bout of COVID, that makes the possibility for a vaccine much less likely. So Amy, your perfect question. Would it be more beneficial for our researchers to focus on finding a therapeutic therapy versus a vaccine? I think we're doing all of it. So I think I talked about the space race. Vaccine should be one of it, and there are like 6 different kinds of vaccines out there. It's so complicated, but there's spike protein vaccines, there's RNA vaccines, there's secret messenger vaccines. There's all these different kind of vaccines out there. And then there's a bunch of different therapeutics, and there are a bunch of different therapeutics that might work. So one of the therapeutics we talked about was convalescent plasma. So convalescent plasma, which is the plasma that you get from people who have the disease, could work. Or what you could do is take that convalescent plasma and purify it. So there are certain diseases where you can actually purify the blood proteins and do it. So we have something called hepatitis B immune globulin. So if you get exposed to hepatitis B, you can get this hepatitis B immune globulin, which binds to all the virus, and then you don't get the disease. So it's possible we could come up with immune globulin. It's possible we could come up with a monoclonal antibody. So monoclonal antibodies are antibodies that are made, and then they attack a particular thing. So there's a disease in kids called respiratory syncytial virus, a different thing. But there's a monoclonal antibody that works for that. It's not great, but it works pretty well. So monoclonal antibody would work. Or there's a possibility that we'll get an antiviral drug, like remdesivir, but better, that really works. So that if you had a therapeutic that really worked, and you went in the hospital and said, oh, you got quick testing, oh, you got COVID, let me give you Bob Dannenhoffer, or whatever we're going to call it. Just give me something, give me that special antiviral drug, and you basically turn it into a little bit of a cold. That would also work. So when I look at the way this is going to end, it's going to end with, it's either going to go on for a long time and be terrible. I don't think that's how it's going to end. We might get a vaccine that works. We might get a therapeutic that works, or a preventive thing, or we might get a drug that works. And I think all of those at this point are equally likely. So Linda says, I went shopping and could not believe the dirty masks some people were wearing. Yeah. So, so improper mask use is there. So there's a great video on our YouTube channel that Kristen made that tells you exactly how to take care of your mask and how to put your mask on. There are people using dirty masks. You should probably wash them. I have about 10 of these, and I put a new one on every day, and that's probably the best way to do it. Now, there are a lot of people who don't have a lot of masks yet, and so they may not be able to launder them every day. But over the next few weeks, I think when people get more and more of these homemade masks, they're going to be able to do a new one each day. Yeah, so Fred asks, why don't we see a state recovered rate like we see locally? So counties were allowed to do recoveries if they had enough time to do it. So recoveries are one of those things you do if you had spare time. Since we've had so few cases, we've had somebody working on recoveries. Other places in the state that are overwhelmed taking care of new cases haven't gotten yet to record their recoveries. So Douglas County looks like we have the best recovered rate in the state. We only do because we have had the time to do it. Other places are doing, actually, there's a team from the state working on cases to record their recoveries. And when they talked about Douglas County, they said, oh, we don't need to do you've already done it. So Lori says in Corvallis, they're doing door-to-door testing. We do that here. So in several places in the state, they're doing studies. So up in the Providence, they were doing an antibody study, results of which we're still waiting for. In Corvallis, they're doing a door-to-door sampling study using a molecular test that was developed at the university. They have a university there. We don't have one here. And then the Night Cancer Foundation and PSU and OHSU is doing this study where they're screening 100,000 people in the state. These are all studies to get some background knowledge of what goes on. And again, typically to do that, you need to have a big research institute working with you. So OHSU, Night Cancer Foundation, OSU are those big areas. We don't have them here. We may at some point do that, but I'd like to see the results of those studies first. This is another my question here. Has the virus mutated? If so, does that make it more difficult to make a vaccine that works? Nancy asked, yeah. So there was a study earlier in the week suggesting that the virus is mutated and that there's a new spike protein on this new mutation, which makes the virus deadlier, spread more, and that basically that virus has outcompeted the original virus. That's great medical mystery. I don't know if it's true. That does happen in other diseases. So back in 2014, 2015, they came out with a flu vaccine. And again, they have to make the flu vaccine in February of the year before. So they made it in February of the year before. But what they found was in the middle of 14, 15, that a new influenza virus outcompeted the one they made the vaccine for. And that one then became the predominant strain, was not protected against the vaccine, and we had this big spike in flu in 2015. I got it that year. It was gross. And so that's important because if it does change, it is going to make a vaccine harder to do, because if it can change, you could put all this time making the vaccine, and then the vaccine wouldn't work because it's changed along the way. Now, that initial study that came out really caused a lot of buzz. Since then, people said, that's not true. Again, we'll know later on if it's changed to a new strain. Yes, so Nancy asked, why we have all these scientists here. This is like old biology. So are the protein spikes attaching to other organs other than the lungs? So yeah, we think this attaches mostly in the lungs to the angiotensin converting enzyme 2 site. Say that a few times. So the angiotensin converting enzyme 2 site. And it's also doing other places. We also think it's affecting the endothelial cells, that is the lining cells in the lungs. And there was a graphic today in one of the things I was reading showing the many places it attacks, including the cornea, which may explain why some of the people early on have red eyes. So yeah, these protein spikes do attach to things other than the lungs. So Brian says, do you think grocery stores should be limiting the number of people in the store? I've seen it doesn't really exist in some stores. Yeah, so some stores are carefully counting the number of people in the store. There's one store that I go to, says only 422 people or whatever can be here. And so they are limiting along the way. Others are not. I have not seen the grocery store rules. I think generally you would like people to limit it. If you have too many people in the stores, you cannot enforce social distancing. So again, the most important thing is social distancing. Grocery stores are big. I mean, they're many thousand square feet, so you could have people in them. But the most important thing is for individuals to do their own social distancing. You can see who's around you. You can wear your mask. You can do this, and we can do this as Oregon. I am so excited that the fact that we brought our rate down, we brought our positive rate down, that in general people are so good about social distancing, and most importantly that people have been really kind to those of us who've had to make tough decisions. So I thank everybody for that. And again, you don't have to be perfect on this. You just have to be really good at it. And so that if you occasionally pass somebody and they're not wearing a mask, I would just say be kind. And let's see, we're almost here. Oh, a couple of things. One is the state put out zip code data this week. The way they did that was if there's less than 10 cases in a zip code, they said it's 1 to 9. We don't have any zip codes with more than 9 cases. So all of our zip codes look like 1 to 9. A question came up earlier about church services. Church services are going to be addressed in the sector guidelines. They're not out yet. And somebody asked a question about testing in the state rules for reopening. They talked about testing capacity. They didn't talk about how many tests you did. They talked about testing capacity, that is, how many could you do? And the way that was kind of figured out would be if you had a really big outbreak, could you test all the people that needed to be tested in that area? So typically with an outbreak, let's say there was an outbreak of 30 cases, you would need to be able to test 10 times as many people as in the outbreak, which would be 300 cases, which is exactly the requirement of 30 cases per 10,000 per week. And that's where they sort of came up with that number. Now, obviously in Douglas County, we've never had 30 cases in a week. We haven't had 24 cases in 8 weeks. So that's sort of where they came from, is the testing capacity. In Douglas County, we're now over 1,200 tests. So we're doing a lot of tests with only 24 positive. We've got a very low positive case rate. Okay, I think that's it. This is Dr. Bob Dannenhoffer. These are lovely masks here. If you want them, we'll put on the website a place to get them with our May 8th update. Again, if you have other questions, I will try and answer them on Facebook chat room tonight, and otherwise we'll see you again on Monday afternoon. Bye-bye.